This is the Fix Your Sciatica podcast.
So let's talk about weed. It's been about 3 to 4 years since I've had this podcast, and over the years, I've had a periodic interview about the use of cannabis in regards to pain management, specifically chronic pain. And throughout these episodes, I've learned a ton and learned a lot about the practical uses of cannabis. And I myself am not a cannabis professional, which is why I interview professionals such as Dr. Leah Johnson, who is a pharmacist and was really kind enough to share her expertise in regards to the use and the power of the cannabis plant. So Leah, it's so great to see you, and thank you so much for being on today's episode.
Yes, thank you so much for having me. I love educating about cannabis. That's all I want to do is just tell everybody everything that they need to know.
Yeah, the reality is, especially here we are at the end of 2024, cannabis and other alternative therapies are becoming a little bit more mainstream because there is in fact research that is growing in favor of these modalities. And I think it's fantastic, especially being a California resident. I live in Marin County, which is actually the home of the first medical marijuana dispensary, which is cool. So it's kind of like a piece of history right here. And throughout my experience, like treating patients, especially transitioning from being a physical therapist in New Jersey, where there was no cannabis use, to actually coming out to California, and just my interactions with patients in regards to their use of cannabis. I remember, I think it was a couple of years ago, I was walking through a patient's garden. They were like, okay, well, I've been dealing with a lot of knee arthritis, and so one of our exercise routines was actually to walk through her garden. And we go through, and I say to myself, is that a cannabis plant? Is that what I think it is? And so as we walk by, she points, it's like, yeah, that's my weed plant. It's like, sometimes I make some brownies, like I find it to be really helpful, but I have to make sure that I don't ingest too much, or else I'm just going to be too high, but just enough is the perfect amount to make my knees and my joints feel a little bit better. And so I'm really glad it's starting to become a little bit normalized, but it's still someone on the fringe, right? And in order for us to make this a little bit more mainstream, we have to have professionals such as yourself to be able to show the research and the benefits and the power of medications and compounds such as cannabis. So before we go into the science behind it, because I'm really, really excited to talk about that, let's talk about yourself, what you do, and your cannabis journey, your cannabis professional journey.
So I am a clinical pharmacist by trade. I also have my master's in medical cannabis science and therapeutics from the University of Maryland School of Pharmacy. Anybody who wants to learn about medical cannabis, it doesn't matter what level or what background you have, they will take anybody, and it is an amazing program. So I learned a lot from that, and that was where my background was. I actually started getting into cannabis therapy even prior to that program. I was working in long-term care, which for those who don't know, it's the same as skilled nursing facilities, usually known as like elderly facilities, but really where the patients live at the facility and they have their medications provided to them and everything. And when I started working there, the biggest thing in the pharmacy world was getting patients off of chemical restraints, is what they like to call them, which is medications that you give to a patient to stop them from being difficult. And I hate to say it that way, and that's why it's called a chemical restraint, because it shouldn't be used. And so we had to find ways that the staff could work with the patients and they could get along and everybody could be happy without patients throwing things or hitting, but with also not sedating the patient. So I had done some certification courses. One was with the International Society of Cannabis Pharmacists, and another one was with the medication therapy management. And both certifications really had you go in, learn a lot about cannabis. And as a pharmacist, I knew about Marinol, and because it's just another medication in our toolbox. So I had spoken after the certifications, I had spoken to the providers, and I said, well, you guys have these patients on these meds that are really not indicated, and they're kind of on them just to prevent them from being difficult and hitting, but that's not what these meds are for, and they really can't be on these meds for that. So then I mentioned that cannabis is very effective for those types of ailments. So they said, Well, the doctor kind of hemmed and hawed and finally said, fine, just so our facility doesn't get in trouble for having psychoactive medications that they shouldn't be on, we'll try Marinol, but only for our patients who are on hospice, meaning they have 6 months or less to live. So I was like, well, at least I'm starting somewhere, and at least I know I'm not going to kill my patients because I know cannabis pretty well. And so we did start the patients on Marinol. It was twice a day. I believe it was breakfast and dinner. And what they found was not only did the patient's combativeness decrease, but their pain pretty much went away. Their anxiety about dying went away. And it also allowed them to eat. It also stimulated their appetite. So these patients who were, who were evaluated to only have 6 months left, like almost half I believe over half of them graduated off of hospice, meaning that when they were reevaluated, they were shown, oh, you're not going to pass away in 6 months. And what happened was just by ingesting the cannabis, they started eating, getting stronger, having less pain so they can move around more. And now they're a living human being again who isn't stuck and sedated in their bed. So it was really helpful to get patients off of a lot of the morphine and the anti-anxiety meds and all that mess. This one med got rid of all these meds these patients were on. And towards the end of working in long-term care, which I no longer do, but when I was working in long-term care, we switched over. By the end, the doctor I was working with said, okay, I'll let you get the combative patients now. So just little by little, he would give me a couple more patients to work with. But again, no negative side effects because the dose was low enough, and it really prevented the need for so much morphine. I mean, pretty much all the patients on the cannabis weren't using the morphine that they were prescribed.
Wow, what a powerful journey that you've gone through. And also it's exciting to see that although your superiors were hesitant, they said, you know what, let's try this anyway. Like say hospice, like they're really, for lack of a better word, there's really nothing to lose. And it was exciting to see the improvements, and it's extremely powerful, which then has driven the implementation into other populations, which is great. You brought up a couple really interesting thoughts that I'll bring up later in this conversation, but a couple things. It's like one in regards to neuroregulation, bringing patients back to baseline, and then another thing that really came to mind, and I'll ask again, is medication indication. And so the reality is the fact that every sort of medication that's out there, or even some sort of therapy out there, even in regards to pain management, like what I do as a physical therapist, is that each thing that we do has a specific purpose. And if we provide that tool for a purpose that it wasn't designed for, then it wouldn't be a surprise that the outcomes are not what is what is expected. And so that's a true story, that really kind of reigns true, especially with what you were talking about. So let's take a deep dive. One of the things I haven't had the opportunity to do, and also I think a lot of the listeners haven't come across, is really the science behind cannabis itself. Now, cannabis is the marijuana plant, but there's a lot of different pieces to that. So I'm going to give you the floor and share with us a little bit more about the chemical compounds. Where does the medicine come from? And then we'll go and follow from there.
So let me pull it all the way down to the basics. So the term cannabis is the umbrella term for any plant that has the chemical genus and species, which is Cannabis sativa. That part is really not important. It's just the most important thing is they're all the same plant. The only difference is that for some reason the government tried to split up the difference between how much THC is in one plant versus another. But at the end of the day, they're all cannabis. So from cannabis is the umbrella term. In the United States, we have what's called hemp and what's called medical cannabis or medical marijuana, or lots of different things, but pretty much what we consider to be the original plant that people would smoke to get the euphoria. So all really that means is, truthfully, all hemp is any type of cannabis with less than 0.3% THC. So even if it's a THC dominant cannabis plant, but the yield of cannabinoids is just low because it was grown poorly or in a bad area, or the weather conditions weren't correct. At the end of the day, hemp means literally nothing except that it has 0.3% THC. The focus on hemp versus not hemp is not what patients should focus on. It means literally nothing. It's a governmental term. It doesn't mean one's better than the other. It doesn't mean one will get you high and the other one won't. It means none of that. It's just governmental, less than 0.3% THC by volume. Medical cannabis, more than that. That's literally the only difference. So then we break it down to why are all these plants the same? So let's go back onto the umbrella under cannabis. So all cannabis plants have what's called cannabinoids in them. Now, cannabinoids are the chemical component, one of the many chemical components in cannabis that provides the medical benefit. There are also other entities called terpenes. Those are the flavor and smell components, part of the flavor and smell, because there are also thiols and esters that help with the smell. Again, not important for the patients, but just so you know, the terpenes are just known to be the smell and the taste, and terpenes are known to have their own medical benefits. So the chemicals in the cannabis plant, I don't like to use chemicals because, I mean, it is a chemical, but the natural products grown in the cannabis plant that are the medicine are the cannabinoids, the terpenes, the polyphenols. So there are many different components, which is why I'm a very big advocate of using a whole plant, full plant extract. And the reason it needs to be that, in my opinion, is because then you get all of the benefits of the plant. A lot of products have isolates where they take just what they want. But if you think about a fruit, like an orange, if you just squeeze out the juice, you get juice, you get some sugar, but you're missing all that fiber that's in that pulp that's so good for you. So it's the same thing I find with the cannabis isolate products versus the cannabis whole plant full spectrum products. Because when these products, they have all the cannabinoids from the original plant, all the terpenes, all the polyphenols, and so on and so forth. And studies are just coming out now, one from Dr. Ethan Russo, showing that the entourage effect, meaning the whole plant used together with all its components, is showing to be more effective than the isolates alone. Not that the isolates can't be effective, but just, a whole orange is better for you than just the juice alone.
Oh, that's so fascinating. I didn't even think about it that way, but it does make sense, especially when you use the fruit analogy, which, yeah, that's extremely eye-opening. So there's all these chemical compounds that come from these different parts of the cannabis plant. So when it comes to like the generalization of how this plant and its compounds can interact with the human body from a medicinal benefit standpoint, tell us a little bit more about what that is like. We'll look at it from like a 1,000-foot view, and then we'll take a little bit of a deeper dive in regards to what it's like in regards to pain management.
Yeah. So as I was kind of mentioning before, like what society kind of focuses on cannabinoids only. We have all these great things, but it's cannabinoids, and the two main cannabinoids they focus on is CBD and THC. So big dive for how it works on the body. We have in our body what's called an endocannabinoid system. And this system, we all have it. All of us have it in our bodies. Dogs have it, cats have it. And what happens is that the endocannabinoid system is a negative feedback loop response to chemicals. So what is supposed to happen is in the body, and the reason, and let me just go back a little bit, the reason why we focus on THC and CBD is because in our bodies, we naturally make what's called anandamide, which is our naturally made version of THC. And we have what's called 2-AG, which is another natural compound we make in our bodies. It's our endocannabinoid, and it works very similar to CBD. And when you look at these two structures, you actually see that our endocannabinoid and the plant-based, the phytocannabinoid, the cannabis plant, actually look very similar, which is why it's able to go into the same locations and work on the endocannabinoid system. Now, mind you, cannabis works in other places as well, but the most important focus is really the endocannabinoid system. So that's really the big view is we have this system, and it's very, and I like to give analogies because I find it's easier to understand. And what I find is that replacing your endocannabinoids. So when you get older, your body starts breaking down, just like we all know. Your systems don't work as well as they used to. I mean, just a normal fun thing of getting older. And what happens due to this is that our endocannabinoid system starts dysfunctioning the same way our systems do. So just like if our body's not making the insulin we need, that we have to give ourselves insulin to replenish it, if our body's not making the endocannabinoids we need, we get the benefit from replenishing them, which we get from the plant. So that's the big overview. The deeper dive is actually due to these disconnects. What ends up happening in the body is when your body's in pain, it screams, I'm in pain, I'm in pain, I'm in pain. It's sending signals out. And the body goes, oh, okay, you're in pain, I got you. And now what happens normally in a negative feedback loop is your body will send messages and it will say, I'm in pain. And then your body says, I received that message. You don't need to send anymore. I hear you. No need to send anymore. So what happens when the endocannabinoid system's not working is lots of screaming that you're in pain and nothing to tell your body, calm down, don't worry, we've got you. So it actually works together. So as the body breaks down, especially pain is a huge one, that a huge but a huge ailment that comes from the body just breaking down over time. And what we found is that the addition of cannabinoids for a lot of different pain ailments have actually been able to replenish what the body was really missing out on. So the point of cannabis therapy is not to get to a place above where you ever were. It's to get you back to baseline. So a lot of people believe that, you take, oh, this works good. If I take more, I'll be even better. That's not how cannabis works. Cannabis is just to start at the lowest dose, increase the dose very slowly, and then stay on the lowest effective dose that helps you with your ailment. And again, different ailments, different properties of which cannabinoids, which terpenes, and so on and so forth to use. But in general, that's really the focus, is fixing the endocannabinoid system with these phytocannabinoids.
Very, very cool. And as you're describing this, I was trying to envision like what this system would look like, because when we were taught in high school or like in elementary school and college, it's like, okay, you have these various different systems. You have your circulatory system, which you can like literally visualize. Your circulatory system as all your veins and blood vessels, lymphatic system as well, respiratory system. I remember going through and not being told what the endocannabinoid system is. And it was interesting because as you're describing it, it makes me think a little bit more about, it kind of acts more like the neuroendocrine system, where it really acts on a chemical basis rather than like, oh, like your skin or your muscles and stuff like that. Is that about right?
You got it. And that's why cannabis is that's why everybody goes, well, I don't get it. How can it work for pain? But then how can it work for sleep? But how can it work for this? It's because it's not working on the sleep system. It's not working on this system or that system. It's working on the general, like you said, the neuroendocrine system. It's working on the neurons directly. Yeah. And again, it works in other places as well, because especially CBD is, does attach to other and actually acts as a modulator, meaning it does affect other areas of the body and other receptors, but really like the endocannabinoid system, cannabis there specifically focuses on getting those signals being sent to the body. So really it helps with reproductive stuff. It helps with lots of things, because anytime there's any signaling issues in that system, it's the endocannabinoid system that's actually causing part of the dysfunction, and it needs to be improved as well to help the improvement of the other systems.
Very cool. And listeners, to be clear, like messages are relayed in many different ways, especially from like the nervous system. Like signals can be passed via electrical current, but signals can also be passed on via chemical changes as well, which is what these compounds can be, which is so fascinating. One thought that came to mind was, and especially going back to your original story of how you got into your line of work, is this concept of indication, like medical indication. And what I found to be so interesting was you brought up this, where was it? It was like this disconnect in regards to, okay, pain is happening, and then the endocannabinoid system and the chemicals actually allow us to shut those signals off. What I found to be really interesting, especially in the world of pain, is that there are many different mechanisms that are at work when it comes to pain, especially when you break it down into acute type of pain and chronic type of pain. I think a lot of people, when they look at not just cannabis, but these one specific tools, they look at it as, okay, if I take this, it's going to just shut off my pain and I'm going to live normally. But it's going to be a lot more complicated, because pain itself is a very complicated mechanism. So from there, let's talk a little bit more about like those like shut off signals that you were talking about? Because I know that especially, we'll break it down first in acute pain. In acute pain, what we're experiencing is like when you injure yourself, whether it be you bump your elbow, in this case of listeners, you pick something up from the ground, you tweak your back, and all of a sudden you're having pain go down your leg as well. The first 12 weeks, you're going through some sort of inflammatory process, and these things are actually happening to protect you from not further injuring it. So what ends up happening is that we have a chemical pathway, so there's actual like inflammation. There's also probably some sort of mechanical disruption as well. And then we actually have the moment when the pain signals from that specific body part actually translate up into your brain. Your brain perceives it as pain.
This episode is brought to you by the Sciatica Protocol. Experience pain relief directly through your phone, anytime, anywhere. Interested in learning more? Check us out at ifixyoursciatica.com/the-sciatica-protocol.
Through your research, Leah, what have you found in regards to, like, if we're talking about acute pain specifically, what are some of the possible mechanisms that cannabis can work in managing something like acute pain?
In general, we are finding that THC is more effective than other cannabinoids for pain. However, the CBD might be more effective for the inflammatory type pain. Some studies are showing pretty much that acute pain, so CBD is, topically, but also ingested, could be more helpful. But there still needs to be THC in there to get the full benefit. And they're showing that for more like neuropathic pain, because it's more of a neurological issue and less of an actual inflammatory issue, that the THC, because it works on the central nervous system, is actually better at controlling that. But in general, for patients with either acute or chronic pain, whether it's neuropathic or not, we usually will have a combination very close to a 1-to-1. But again, it all depends on how well the patient can tolerate the THC dose. So if the THC dose, let's say, I'm going to give what I would consider a higher dose, so I don't recommend this to patients. I also recommend definitely working with somebody before you just go ahead and dose, because to prevent any side effects or issues. But in general, let's say people have a 5 milligrams of THC to 5 milligrams of CBD, and let's say that's it's helping with the pain, but it's too sedating for them. That's when we would add more CBD to help balance out the sedation feeling of the THC. So that way they could still get the benefit, but then we just kind of push the CBD a little bit more to have it so it balances out, so they're not getting that side effect. Because the biggest thing is the euphoria or the high is from the THC for the most part. I mean, some people do feel drowsy on CBD because it can help with sleep and anxiety. But in general, it's the THC that really causes the high, as people refer to it. And truthfully, all the high really is pretty much taking too much of the medication. That's really it is. It's a side effect is really what the high is. It's no different than somebody taking a Percocet who isn't in pain just because they wanted to feel the high from the Percocet. It's the same thing with cannabis. If you use cannabis and you've got no reason to, and you just feel like you want the euphoria, it's the side effect that the person's going for. They're not actually going for the medical benefit. Not that they couldn't still get the medical benefit with taking a higher dose, just that they've overdone where they probably needed to go to for the benefit. So when I work with patients, nobody gets high, nobody gets that euphoria. At worst case scenario, if we had to increase the dose, but they thought it might be too high, they were a little sleepy in the morning, and that's at max. And that's why I always recommend to work with somebody, because cannabis science is not simply just or cannabis medicine is not simply just the compounds. It's also how the product is made and where the product comes from, because an inhalation product versus an oral product versus a tincture, truthfully, the cannabis field doesn't use the word tincture correctly. Tincture is actually an alcohol-based extraction, but for some reason, they think it's oil in the cannabis field. So the cannabis tincture is oil-based. And then there's topicals and everything, suppositories, and they're all used for long-term treatment, for short-term treatment, for breakthrough treatment. So it's always important to work with somebody who knows the different products on the market, knows the reputable ones, especially because in the hemp market, meaning anything that has 0.3% THC, they start altering cannabinoids. So they have, if you hear the word delta run, is pretty much what I say to anybody. You hear delta run. Natural THC is delta 9 THC, but nobody would call it delta if it was naturally derived. Really, the most important, if you work with a healthcare professional on cannabis, they help you both with dosing, they help you with avoidance of side effects, they also help you with the formulations you need and how to use them, and to bridge you to the final therapy you would need so that you can continue it ongoing.
Wow, thank you so much for that breakdown, because I'm learning so much as you're describing this, and I'm already thinking about from like a practical application, not necessarily like my patients, like you should be turned, like obviously they should be working with a professional, but when you're looking at the use of THC, if we're looking at THC from it working on the central nervous system as compared to the CBD, which is going to be more working on the periphery, possibility for that inflammation, it then actually helps us. I think it helps everyone, because my job as a physical therapist when I'm working with a patient who is dealing with pain, let's say, for example, in this scenario, sciatica pain. Sciatica pain itself, we're looking at an irritation of the sciatic nerve, but that irritation of the sciatic nerve could actually be caused by multiple different things. It could be truly some sort of inflammatory process, whether it be that they're facet or they have a herniated disc, or they have tripped, like slipped and fell, and they really bruised their gluten piriformis. So there's actually significant inflammatory processes that are happening, in which something like a CBD could be possibly helpful, just given like the use cases of what you were discussing. But then what's also very interesting is, because I also work with a lot of folks who have been dealing with the chronic stage of pain. Now, chronic pain is a very interesting field, because I truly believe people reach the chronic stage of pain for a couple of different reasons. Number one, I would say the majority of the reasons why people reach the chronic stage, especially in low back and sciatica issues, the reason they reached that chronic stage is because it was already poorly managed during the first 12 weeks of their rehab. For some reason, they went in, doctor, physical therapist, chiropractor said, oh, you have sciatica pain. And they gave them the run-of-the-mill exercises, like the 13 different exercises you can go on Google, which unfortunately, you go on Google, those 13 exercises, if you look, each one of those exercises actually counteract the effects of the previous exercise. So what that means is, here's this like run-of-the-mill routine, which as a result it might not necessarily help us. And as a result, because it's poorly managed, they've reached the 12-week mark, they're in the chronic stage of pain, and then they're told that the pain that they're dealing with is just in their head. So what ends up happening is that they get drawn into the chronic stage of pain, and then and maybe they get pushed into using stuff like THC, where it's like, okay, it's enacting on the central nervous system, but maybe we actually need to work more on the periphery, figure out what are they doing in the first place. And so this really brings up the importance of how a collaborative effort amongst all healthcare professionals, but then also you listeners, when you're working with your providers, you have to share every single specific detail. Because you could be going to someone like Leah and be like, okay, well, I've been in pain for this amount of time. But if it was just described to the point where we're listening to this information, it's like, oh, well, it seems like it's more on the chronic, more like we call it central sensitization, the more central nervous system. All right, maybe we're going to go through this route, which then goes into this whole concept of medical indication, right? Medical indication means that whatever tool we're providing is designed to address a specific problem, which in the realm of medicine, yes, it's kind of an educated guess based on the information that we're given, but it's an educated guess with a consistent refinement, which means that we should never give up in trying to figure out what's the solution to this, right? And so I really appreciate you clarifying the difference between THC and CBD, because those are the two largest players in cannabis medicine, and often gets misunderstood, and I'm already learning so much as it is. As you were describing this, another question that came to mind is, we know that we have the endocannabinoid system, and it's like we produce it ourselves, and if we run out of it on our own, that's where we start to experience dysfunction. We add or supplement with these compounds to help us better. So is this a matter of, is the use of cannabis fall more under the line of what we'll call it like prevention? Like, is it something that you take on a regular basis to prevent things from happening? Or is it really more on the therapeutic and treatment side, where it's like when there's a problem, we transition into that?
This is why people hate cannabis. It's both. And that's why, not people, but that's why healthcare professionals hate it, because they, as a healthcare professional, and I'm one too, just like you, and we like our boxes. We love putting things in boxes. Plant-based medicine doesn't fit in any of the boxes. It kind of is a blanket over all the boxes. So it makes it very difficult for that. It makes it a little bit difficult for that focus to just say, one versus the other. Trying to think of a best way. I'm trying to think, can you just phrase the question again? I just want to make sure I'm answering it correctly.
Yeah, I was trying to figure out, well, let's just say, yeah, is the use of cannabis, does it fall under the umbrella of mostly the preventative medicine standpoint or more of the treatment? So I'm going to take another step back. Right now, we're in an age of the evolution of what we call medicine 3.0, right? Medicine 3.0 has been really focusing on the prevention of a lot of ailments, specifically in the longevity, prevention of death, right? And unfortunately, the medical community, given the way that the industry is, we're very much on the medicine 2.0, we treat the problem when it happens, right? And I definitely understand, there's a lot of issues with preventive medicine. One is the fact that, it's really hard to measure prevention, right? We have to spend a lot of time if we look at the cigarette smoking, right? We actually had some very, very clear data on the fact that you stop smoking, you have an X amount of risk decrease in death, right? And so I'm really interested to see well, sorry, I guess I wasn't giving you a very good question, but if we're looking at with prevention and treatment, is it equally weighted?
So the way it all goes based on the formulation you use and the cannabinoids being used. And that's what kind of makes it a little difficult. So for example, for people who use it for anxiety, they would take it every single day, or even for pain, they would take it every day to prevent the pain. However, if they're currently experiencing pain, they can take a different type of formulation to treat the pain. So that's kind of what I meant. It's kind of a blanket. It does everything depending on how you use it. So if you're in pain and you take a topical cannabis product and you rub it on, you're going to feel relief pretty quickly. And that is treatment. But at the same time, if you always, for example, I have a patient with MS and her biggest problem is pain, and she will take the medication to prevent the pain. And then she knows when it's time for her next dose because the pain will start coming back, and she'll be like, oh, now we know I should have taken it sooner to make sure that pain didn't come up. So really, it's all based on timing and formulation and cannabinoid kind of distribution. But in general, like I said before, the orals are more for preventative. You're going to want to take the oral, and it usually takes about an hour to 2 hours, depending on what type of oral you take. And it usually lasts for about 6 to 8 hours, again, depending on the edible. And again, this is a great type of formulation for preventative, because you take it, it's just like taking any, I have depression, I'm going to take this medication, it's going to prevent my depression. Okay, I take this cannabis product, it's going to prevent my pain or prevent whatever it is we're preventing. But even for pain, let's say, it was working and all of a sudden I went for a walk and now my knee is just throbbing. Okay, well, yeah, you can slather that topical on there to get the pain into to get it into that area. You can, if it's so severe, you need to inhale because you need instant relief because it's really bothering you. You can do the inhalation to get rid of it. The only issue with inhalation is the dosing of the cannabinoids has to be similar to what was being given before. So for example, if it's, let's say, CBD in the same relation to THC, in the same ratio, let's say, you'd want to have an inhalation that also had that same, like a 1-to-1 or whatever it is, because you want to make sure what was working to prevent the pain before can be used to also treat. But it really comes down to how you take it. It's the same as you take a rescue inhaler for asthma and you take it before you have any asthma symptoms, but the second you start coughing, you're going to reach for that rescue inhaler so you can keep breathing again.
That makes a ton of sense. And the reality, as you were telling me this, I was like, it's really more of a management type of thing. It's not, right? It's really more some management. Which then you brought up this concept of formulations. And so throughout this conversation, you're making it very, very clear that in order for you to get the maximal benefit, especially from a health care and medicine standpoint, that is that you work with a professional on trying to get the best formulation for you. So tell us a little bit more about what that process is like, and is it something along the lines of like they go and then it's like, okay, like buy like whatever, and you go to your like nearest dispensary and you're like, I guess I'm gonna get the one that's closest to what my doctor recommended. What's that like? Because there's certainly, it's dispensaries are growing in number. There's certainly like licenses growing. Again, we live in California, so it's legal here. And it's starting to, like, the legalization is starting to get a little bit more. So that means that there's going to be a lot more options available, which can be overwhelming, right? So share with us that process of like going to a professional like yourself and then to the point where they're ingesting or taking in that compound.
So all I can go over is how I do it. Every practitioner works a little differently. And actually the majority of not the majority, but a lot of my patients are those that went the dispensary route first and had a terrible response and then came to me, which sadly is kind of usually how it happens. It's nice that they're still willing to try cannabis again the proper way, but it's a shame that they didn't just start with somebody who knew what they were talking about. The best thing is never to take advice from a dispensary when it comes to health. Unless it is the dispensary that is being run by a healthcare professional. Most dispensaries have bud tenders and they can be very intelligent. They could have a lot of knowledge, but at the end of the day, legally, only somebody with a healthcare license is allowed to legally give medical advice. So that's the first thing I definitely want to say. So for when a patient comes to me, I actually have them provide me, I do what's called a comprehensive review of their full history. So I do pretty much exactly what you would do when you go to a new doctor. The doctor gives you a questionnaire to fill out so they can get more information. They get labs, your previous lab work, your previous medication history. And then on top of all the general stuff that I get from everybody, I also get the background on their cannabis use. Whether it's, hey, I smoked when I was in college, never used it again. I've never used it in my life and I'm terrified of it. Like literally I've had the gamut. I use it every day because I like to get high. I've literally had the gamut of patients. So and the funny thing is, and what I always say to people, the reason why it's not cookie cutter where somebody can just get advice and just go and fix themselves is because everything is cannabis medicine is truly patient based. And the reason I say that is because you can work with two twins. They have literally the same ailment. They're identical twins. They have the same anatomy. They have the same chemical makeup. And one, like I've known two twins. One actually gets the psychosis from cannabis and one gets benefit from it. And they're identical twins. So it's just fascinating. And that's why I always say you need to work with somebody who knows what they're talking about, because your best friend might be identical to you, but your outcomes of what you need and what they need, even if it's for pain, could be night and day. So what we do is we get all that review, and then I have the patient send it to me. I do a comprehensive review. I notice any medications or supplements or herbal supplements or general supplements that are possibly missing or incorrect, like there's no reason you should be on this, or hey, this might actually be triggering your pain or anxiety. And then I do the same thing with the labs to see if they're missing anything. And then the first part of the review is really just the basics, what they're coming to me for and everything. And then I go down kind of the wormhole of, any labs I see missing that it's really important to evaluate, any medication that either should be taken that's not, shouldn't be taken that is, or even more importantly, taken at the wrong time. Just a quick aside, I had one patient who had anxiety and insomnia, and we just switched I switched when her meds were taken. And they were both gone because she was taking her upper med at night which was causing her anxiety. And during the day, she was taking another med that wasn't helping. So it was just like, so luckily we got her off. But that's why it's so important to have somebody who knows medicine, because they can do this review and really make sure that you're not missing anything. Because there are interactions with cannabis with some meds. There are people who aren't really indicated for cannabis, especially those who are, in their younger, I don't say children, but younger people in their 20s who have a family history of psychosis. Those are the type of people we really don't recommend cannabis for, because it could lead to initiating that psychosis. If the patient was not predisposed to psychosis, it's not going to cause it. But if somebody does have that in their system, it could trigger it to come out and be presented earlier than it would have if they had not had it. Which is why, again, Another reason why you always want to check. And then once I do all that, everything kind of depends on the patient. So my last patient, she has already been on CBD. So I didn't need to worry about, can she handle it? Is she going to be, because the biggest thing I check first is allergic reaction. Because if you've never been on cannabis, you don't know if you might have an allergic reaction to it, because you have allergic reaction to almost anything pretty much. So I start them on a low dose. But again, for like my patient now, she's already been on CBD, so I already knew what dose she was in. So as soon as I find that out, I kind of dig down to figure out, I find out the company, and I do the same thing for my patients if they do a dispensary based on what product I'm recommending. So if I know, okay, patient is already a THC user, they're already on this level of THC with, but they're not using any of these other cannabinoids, then I say, okay, well, they're not on the best product, so we need to change it. But now I know that they can tolerate higher doses of THC. So then I would know, well, you can't do a mail order product because you need something with higher THC that was only available at a dispensary. And then I actually go and research all of the dispensaries in the area that patient lives. I look at their menus, I look at everything, and I don't just give them a recommendation, I pick a product. But I don't pick a dispensary because it's actually no different than as a pharmacist. It's like a gray area. It'd be like me saying, don't go to that pharmacy, go to that pharmacy. It's like, if they have the same product, you can't tell them where to go. So you can tell them the product, what I usually do is I give them like 2 to 3 different products that are all exactly the same thing, but just different companies. So they can go and find out, oh, this one's a little cheaper here, or that one tastes gross. This one tastes much better. I'd rather take this one. And then they can decide. But all in all, I always guide, because you can't just send somebody to a dispensary. And that's what a lot of times, even when you go in to see a doctor, sometimes they'll say, here's your rec for cannabis medicine, enjoy. And then they go to the dispensary, okay, I have pain. And then you go, the bud tender again, sometimes there's good ones, sometimes there's this stuff right here. This stuff, you with no pain. Yeah, it's the jam shiz, people. And no, that's not where I want my patients to be. I want my patients to know this was the product that my practitioner recommended to me. This is the product I'm getting. And which is exactly why I look at the dispensaries, because you can't assume what will be at a dispensary, especially because I work with patients throughout the country. As you know, in California, whatever happens in California can't go to other states. So I have to know what they have in their state. Very often I actually work with, and I don't mind recommending them, and anybody can look into their products. It's called Unity Formulas. I'm not associated with them. I don't work with them. But I do recommend that product, because it is a hemp-derived product. And again, all that means is a cannabis plant with less than 0.3% THC. And they do only natural extraction. So they don't actually manipulate or have synthetic cannabinoids, which is just dangerous and bad. They always directly extract it in an oil form. So they have many different things. It's funny because very often their thing will say anxiety, and it's like, yeah, I'm using that for pain though. And because I ignore the labels, I hate labeling, because I love labeling if it's done properly, but I hate marketing labeling, because that's great. You're using it. Your company says it's for anxiety, but that ratio is what I want to use for my pain patient. So I always tell patients, just ignore the title on the bottle. Trust me, this is what you need. And that one's great because that company actually ships throughout the US and will ship overseas. So for my overseas patients, it's helpful too. The issue is when the patient starts needing those higher dosages of THC, and that's when you really have no choice but to have them go to a dispensary. And that's when you got to do your research. So the most important thing I would say is definitely work with a cannabis expert, but make sure the cannabis expert knows what they're talking about. Because if they're not doing the research for you, you need to work with somebody who actually does the research for you. I never let my patients flounder. I think it's awful to leave patients floundering. Why start on a medication like cannabis or any medication if the only thing that's wrong is you're taking your meds at the wrong time? I mean, switch those up, make it real simple, and it makes it easy. So it's really just, you need somebody that's going to put in the work and really do the review for you, and that really understands cannabis. And there are lots of people out there that are not healthcare professionals that educate on cannabis. And truthfully, again, by law, if you're not a healthcare professional, you're really not supposed to be educating on any healthcare thing.
100%. And so I appreciate everything that you're saying. Patient-centered care, really we really have to experiment and see what works for our patients. And like, as you said, you had twins and one twin responded one way and the other twin responded to the other. So working with a professional is huge. And the listeners can just go on Google being like cannabis expert, but there are a couple of resources that you actually are a part of that the listeners can actually get a lot more targeted information. So for the listeners who are out there who are like, I have some questions for Leah, what's the best way to get in touch with you? And then I know that you also are part of an organization that is all about cannabis, especially from a pharmacist standpoint. So share us that info too.
Sure. So I don't know if you can put like a little picture up, but it'd probably be easier to show my email since it's pretty long. But my email is drdr.leah. I'm sorry, I apologize. It's Dr. Leah. You can put it or not, don't need to. And then at alchemistcannabisconsulting.com. So it's a bit long. It is Dr. Leah, Leah, so drleah at alchemistcannabisconsulting.com. So anybody can reach out to me there, and I always get back to people who respond. If for some reason I don't respond in a week, send another message because it could have gone to spam, but I usually check my spam too. And I'm always happy to answer questions. And if there's always general questions, I feel that this knowledge should just be available to the entire society. I think everybody should just have it. If it's more specific about your own care, then it would be something that would probably require an actual consultation and review. For the general information, if you just really want to learn more about cannabis, learn more about and watch different maybe webinars or different explanations about different things such as elderly in cannabis or the endocannabinoid system, or to learn more about that system. Also to get more insights about the rescheduling that the government's talking about for medical cannabis, you would go to www.pcccrx.org. And that is the nonprofit organization that I developed with my colleagues and I work with. And we just provide free education around the U.S. to anybody who is interested in cannabis education. We actually have a webinar coming up in January, which we have posted, so you can see where that's going to be, where the link is to that to register. It's free registration, free access, and it will be on cannabis and the endocannabinoid system. So that should be really, really interesting. And again, we're happy to answer any questions, and I'm happy to answer any questions. The most important thing is to be educated, and there is no stupid questions. I know I've hit a point in cannabis research that I'll get asked a question, I'm like, okay, I need to backtrack. Sorry about that. So no question is a stupid question. And I always say that to patients because sometimes the question they don't ask is the most important question. So always feel free to reach out to me. Always feel free to ask questions. And if you have and if you really think cannabis therapy is for you and you have a provider that's not for it, I hate to say it, but I recommend looking into a potential different provider. It's not that they have to know about cannabis, but there are some providers who are very anti-cannabis. And you should never lie to your provider about all the different therapies you're using. They need to know this. It's so important. So I always make sure all my patients I work with are also that their primary caregiver knows that they are working with me on medical cannabis, because it is so important that there is all communication. And the most important thing is you never want to keep things secret. You always want to be honest and open. And if you don't feel you can be honest and open with your provider, find a provider you can be honest and open with, because that's how you're going to get the best care for yourself. You need somebody you can ask questions to, and you can really pick someone's brain, because you should be able to understand your care. And if you don't, you should find somebody who explains it to you in a way that you understand.
And on that note, thank you so much, Leah, for taking the time to sharing your expertise and sharing the importance of this education, which is extremely important. And for the listeners, if you did not get a chance to write all that information down, I'm actually going to be putting the links into the show notes. And I'm so thankful for the information that you share with us, Leah. Thank you so much for your time.
Absolutely. Happy to be here.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.